Good evening and welcome to Health Quest. I'm Deborah Arneson, your host once again tonight. And tonight we have a wonderful show, not for women only, but certainly geared towards our women viewing audience. And tonight we're going to be talking about hormone replacement therapy. Do we need it? Do we not need it? What are the pros? What are the cons? What are the risks? So tonight we have a wonderful guest who's taken a portion of his time out of his day to be with us and share this really interesting, necessary information with us, especially as so many of us baby boomers are starting to segue into menopause. So tonight we have Mr. Carter Black, who is a compounding pharmacist, and there is a difference between compounding pharmacists and regular pharmacists. So thank you for being with us, Carter.
Thank you.
It's a pleasure to have you here.
Nice
So
to be here.
tell us a bit about yourself. How on earth did you ever come to be a compounding pharmacist?
Well, I wanted to be a compounding pharmacist. I've been in the field for 25 years, and it's kind of a specialty practice. We are just like a internist might refer to a surgeon for surgery on an appendectomy. Other pharmacists or doctors or nutritionists would refer to us for nutritional support, or if there was a compound to be made for a patient. In other words, something other than a set dosage form.
So you like the actual kind of Merlin magic about it. You're actually doing very user-specific prescriptives for people rather than a set kind of staid prescription, which is generic for all people.
Right, right.
Yeah,
and
so
it's a thing that, you know, I can solve the patient's medical problems, and I get a chance to get involved with the patient, and that's a very important thing with me.
That's wonderful. So, and one of the things that's wonderful about Carter and in dealing with him, with my women, he is more than generous with his time. You allow the women to call you and have conversations with you, and you work with the doctors, with the nutritionists, which is really unusual because we know in this day and age of craziness, it's hard to find a professional in the healthcare industry who takes time, plain and simple. So that's one of the reasons I have enormous faith in what he does, not only because he's a wonderful compounding pharmacist, but he cares, which is amazing. So we're pleased to have you. So how can a compounding pharmacist help women?
Well, basically what we can do is we can be a referral source. Also, we can fit the medication to the patient. So many times in a prescription, the woman has to take what's available, and that's not always necessary. Women today are very individual, and we like to put something with the patient that they have a chance to be successful with. And the idea of fitting the medication to the patient is important.
I think that's very important, especially when it comes to something like hormones, right? I mean, we're looking at a very unique, everybody is so unique biochemically, so of course, you know, I may need more of one type of estrogen than another woman, and most women don't even know there are 3 estrogens that we basically test for. So I may need more estrone or estriol, or more progesterone or testosterone, and a standard prescriptive would give you a certain set dosage of usually just progesterone and estrogen, right?
Right.
And no testosterone.
That's right. Well, what we can do is we can provide counseling to the patient. Also, we're available and accessible. We have a compounding practice that is open about 80 hours. So, you know, it's a long time.
We're there,
yes.
come rain or shine.
And we're one of the most accessible of the healthcare professions. So usually someone can get an answer to a prescription problem or question
Almost
most of the time.
Yeah, that's great. Well, it's interesting, too, because even in my practice, being a clinical nutritionist, I clearly see that the patient, by and large, is very trusting of pharmacists far more so than their physician because of availability in good part, I believe. You know, it's like nice to have someone who you can pick up the phone and they'll talk to you and answer a concern or a question. Because when the concern is there, it's usually imminent. You need the answer quickly because you're in a position of like, what's going on with my body? What is this drug doing? How should I be feeling? Is this normal? You know, so.
And we provide a lot of triage that way. We try to find out if the patient's in immediate need, they need to go to the hospital, or they need to call their doctor, or we need to call their doctor for something. Okay. So it's really, if you become a pharmacist, you have to have a lot of compassion, and I wouldn't recommend anyone go into field at all.
If you're not compassionate.
That's right, because the hours are long, but it is very rewarding.
Yes, it is. To see people come to a place of wellness is always very gratifying, I know. So what are the benefits of hormone replacement therapy, in your opinion, Carter?
Well, there's immediate health benefits, and then there's long-term health benefits. We try to factor in age, family history, lifestyle, nutrition, present conditions. Age is an important one. Where are you in your life? Are you premenopausal, perimenopausal? Even teens can benefit with hormone replacement therapy. Teens have a great deal of PMS, and it's not recognized, and it's kissed off as something, you know, oh, that's my daughter, or that's my, you know. Then when you're pregnant, there's help we can give to become pregnant, also to support the pregnancy. Some of the biggest benefits we've had is to prevent spontaneous abortions by women that are pregnant by supporting the endometrium with progesterone. In the Middle Ages, that's the age of PMS. Perimenopausal, and I say more, that's a real adjustment period when you're just starting to lose your estrogen.
And that starts approximately what age, as far as what you're seeing now in America?
Well, actually,
younger.
It's really younger, anywhere from, you know, the early 40s, and we're even seeing some very late menopauses too. So the ranges are so big, and that's why we're going to talk about some testing later. But postmenopausal, obviously, that is a time when we need to think about supporting the woman with maybe some estrogens, progesterone, testosterone, a few things.
So the question I have for you, and this is something that we don't have here on our list of questions to ask, and maybe you can put some light on this subject, is are you seeing more and more hormonal disruptions or imbalances? And if so, which I'm sure you are, but if so, in your estimation, does it come from a lot of the pesticides and the endocrine disruptors we're all exposed to in our culture, in our society, in our agribusiness, in our food chain?
Oh, absolutely. I mean, that's called false estrogens. They have a name, xenoestrogens, or but what they're doing is they're locking on to a woman's estrogen receptors, and they're not letting them go. And we're seeing so many different types of symptoms of like false estrogen overload when it's not there, causing all kinds of health problems.
Do those false estrogens show up on a hormone panel test?
I haven't seen that, no.
Can you tell if it's really estrogen, or is it the fake estrogen?
Yes, that's why a good history is so important. And also, not only just a history of what's going on, but also what's your lifestyle like, where do you live, you know, do you live on a farm, you know, or out in the suburbs, and do you have one of those lawn services, or does your husband fool around with the chemicals out there? I mean, what's going on?
Do you drink tap water?
Do you drink tap water? What's your nutrition like? You know, fast
How much
foods.
Coffee do you drink to reach
absolutely.
things out?
So it's a very interesting effect that the women are getting.
And it's a huge industry right now, again, because so many women are starting to segue into perimenopause, and menopausal flux is younger and younger. So, and again, the standard treatment, if we can create some clarity for a viewing audience, is that, you know, it's either to do or not to do for hormone replacement therapy. And what we're trying to do is give you a venue or an avenue to show you that there's an alternative that's very user-specific, so you don't have to take a generic prescription for estrogen, which is not, in fact, oftentimes the type of estrogen you need, or progesterone, and it may be too much progesterone or not enough progesterone. So you can do, you know, a test or a series of tests that will allow you to seek the help of someone like Carter, who's a compounding pharmacist, who will create prescriptive cream or sublingual,
sublingual, we can go
drops under your tongue that are very, very specific for your body. So you're not taking a generic hormone replacement, which is so silly.
Well,
and you see a lot of weight gain in women who do that too, because they're getting too much of the wrong one, right?
It's out of balance. And that's it's something that we need to determine by, as you were alluding to, saliva tests and a great history. This is the way that we can really get an idea of what's happening with the women.
Well, how do you determine someone needs a hormone test or replacement therapy even? So you determine they need the test because why? They come to you with what types of concerns?
Well, obviously, if you have no problems, you're going along fine, you're not going to seek my help.
So if energy is good, you know, if your bowels are moving fine, if you're not moody and crying and explosive, and or if you're working out, like I have women who work out a lot, but they can't build muscle, which means sometimes what? More estrogen, not enough testosterone?
Right.
Could.
It is. Weight gain, all kinds of things. Depression, urinary problems, sexuality, everything goes into the mix. And obviously something is not right or something is broken when they come to us. So what we have to do is we have to do a very good history, and usually we use saliva tests.
Okay.
And saliva tests gives us a good picture of what's going on, especially if we can get them during different phases of the woman's cycle, if they're cycling.
So you would test during, like, how many phases of the cycle?
I would really like to see all phases, the luteal, the follicular, and also during the menses.
Okay.
To see.
It's going to fluctuate so much.
Yes, and if the woman will go along with this, so that we could have a baseline, and then, you know, a few months later, after we've done some treatments, after we've done some adjustments, we don't always have to go to the natural hormones right away. We can try a few other things before we do that. Some women are hesitant, and that's fine with me. There's nutrition, there's herbs, there's all kinds of help.
So would you literally do a hormone test on anybody who was presenting with these types of problems over a blood test, and if so, why?
Well, blood tests really just give you a snapshot. They really don't give you a sense of what's going on with the women, and let me explain why. Saliva tests give you the unbound hormone that's in your body that's acting on your body.
It's called the free fractionated?
The free fractionated hormones.
Okay.
Okay. All the other hormones are bound and they're not active. So if we really want to know what's going on, we don't take a blood test, we take a saliva test.
Okay.
Then we can tell what is going on with a woman, and then we can...
So bound means they're being used?
No, bound means they're not being used.
Okay.
The free
means they're being
means
used.
they're affecting tissues.
Okay.
And they affect every tissue in your body. I can't name it. Absolutely.
The thyroid,
eyes,
the breast,
you know, everything. So we're not going to see any effect on a bound estrogen or progesterone or testosterone.
So that gives you nothing other than a snapshot of what's bound up.
Right, if it's a blood test.
Okay.
And so many physicians are relying on these blood tests. That's why you're going to need to do some research on your own and possibly school your physician on this.
And tell him that you're interested in doing this.
Right.
Because most doctors, it's been my experience that most physicians will do what they're comfortable doing and what's been embraced by their associates for the most part. But I think Dr. Christine Northrup has brought the most information to the table with her hormone panel tests, and she uses the University of Madison, I believe, for her lab. And I think there are 2 or 3 in the country that do these assessments, right?
Well,
major ones?
Right. If you get on the internet, or if you would ask you or I, we could give you resources for saliva tests.
Right.
And I'm sure that your physician's been approached either by his patients or labs wanting their participation in this effort.
Sure.